All hail Satan. All hail Satan.
Hi guys.
Maple syrup disease is an autosomal recessive disorder, and the major feature of maple syrup disease is inability to degrade the branched-chain amino acids. To branched-chain amino acids belong isoleucine, leucine, and valine. The reason why branched-chain amino acids cannot be degraded is genetic defect in branched-chain α-keto acid dehydrogenase complex. So, to explain the pathogenesis of maple syrup disease, we have to know the pathway of branched-chain amino acids in the body.
Right, you like this?
To branched-chain amino acids belong leucine, isoleucine, and valine. When branched-chain amino acids come into the body, initially we convert them into α-keto acids. Leucine undergo conversion to α-keto isocaprate, isoleucine to α-keto beta-methylvalerate, and valine we convert to α-keto isovalerate. The next step in α-keto acid metabolism depends on activity of branched-chain α-keto acid dehydrogenase complex, and we have to know that the cofactor of branched-chain α-keto acid dehydrogenase complex is thymine. Branched-chain keto acid dehydrogenase complex converts α-keto acids to substances from which we can produce energy. It's acetyl-K, acetoacetate, and succinyl-K. All of them potentially we can use in the Krebs cycle for energy production. Energy we need for a lot of things, but in childhood we need energy mostly for a proper growth and development of organism. And also we need energy for glucose production, and it's pretty much the entire pathway of branched-chain amino acids in the body. But sometimes something can go wrong.
I assume this is about
Armageddon.
Yes.
In maple syrup disease, mutation disrupts the normal function of branched-chain keto acid dehydrogenase complex. Without branched-chain keto acid dehydrogenase complex, we cannot degrade alpha-keto acids. So now, without branched-chain keto acid dehydrogenase complex, alpha-keto acids begin to progressively accumulate in the blood. With time, dysfunction of branched-chain keto acid dehydrogenase complex also causes accumulation of branched-chain amino acids, so the level of all branched-chain amino acids in the blood increase. The major pathway how we can excrete the excess amount of branched-chain amino acids and alpha-keto acids from the blood is by urine. So, with increasing branched-chain amino acids and alpha-keto acids in the blood, their excretion by the urine increase, which results in increasing concentration of branched-chain amino acids and alpha-keto acids in the urine, and extremely high concentration of branched-chain amino acids and alpha-keto acids give to urine a very specific smell. We call it maple syrup smell or burnt sugar smell, and it's the reason why we call this disorder maple syrup disease. Another problem is that with accumulation of alpha-keto acids in the blood pH decrease. The reason is that alpha-keto acids are acids, and as any acids they create a more acidic environment. So the higher the concentration of acids in the blood, the lower will be the blood pH, and accumulation of alpha-keto acids in the blood create metabolic acidosis. The major problem with accumulation of branched-chain amino acids and alpha-keto acids is that in high concentrations they are neurotoxic substances. First of all, their neurotoxic effect cause development of encephalopathy, and encephalopathy manifests with lethargy, vomiting, poor feeding, irritability, and seizures. In addition to this, with increasing branched-chain amino acids and alpha-keto acids in the blood, their income into the brain tissue increase, where they undergo conversion to glutamate. The problem with glutamate is that in high concentrations, glutamate can cause overstimulation of excitatory receptors, as NMDA for example. This will cause increase in potency of neuronal stimulation, and most commonly this results in abnormal muscle contractions. This state we call opistotonus. In addition to symptoms which are related to accumulation of brain-chain amino acids and alpha-keto acids, we have symptoms related to inability to degrade alpha-keto acids to smaller substances. As we see, without brain-chain keto acid dehydrogenase complex, we cannot produce acetyl-K, acetoacetate, and succinyl-K. This causes decrease in activity of the Krebs cycle, and thereby it causes decrease in energy production, and chronic energy deficiency causes growth and developmental delay.
You guys grow better!
Additionally, in energy deficient state, we don't have energy to produce glucose, and with time, decreased glucose production causes hypoglycemia. The treatment is very simple. We have to avoid brain-chain amino acids. With decrease in consumption of brain-chain amino acids, the concentration of brain-chain amino acids in the blood decrease, and subsequently, the concentration of alpha-keto acids decrease. Decrease in both brain-chain amino acids and alpha-keto acids can prevent damage to neural system, and also it substantially reduces the severity of metabolic acidosis. In addition to this, we can prescribe thiamine. The logic is that thiamine is a cofactor of brain-chain keto acid dehydrogenase complex. So, by prescription of thiamine supplements, we can improve the function of brain-chain keto acid dehydrogenase complex, which can help us to eliminate the excess of brain-chain amino acids and alpha-keto acids from the blood. Now, let's discuss the real-life case of maple syrup disease. The patient is 8 days old female who had nasal congestion and poor response for 3 days. Also, she had poor breast intake, poor mental reaction, and hoarse crying. In her blood analysis, we see very low blood glucose level, so she had hypoglycemia. Her blood pH was 7.2, which is low. Low blood pH tells us about acidosis. She had low level of base excess. Combined low blood pH and low level of base excess tell us about metabolic acidosis. She had increased partial pressure of oxygen and low partial pressure of carbon dioxide. These changes in blood gases develop in order to compensate severe metabolic acidosis. So, the patient had 2 major features: its low blood glucose level and metabolic acidosis combined with respiratory alkalosis. All these features are the signature manifestations of maple syrup disease. Also, we see that the patient had neural injury, which was determined by MRI, and spectrometry showed a significant increase in leucine and valine in the blood, and we know that it's brain-chain amino acids. In addition to this, patient had increased concentration of keto acids in the urine, and genetic studies determined that patient had homozygous mutation in gene which can cause brain-chain keto acid dehydrogenase complex. The treatment approach was simple: to remove all brain-chain amino acid component from the diet. In this case, it was milk powder.
Great. Fine. Yep. Ciao. What's that mean? Ciao. It's Italian. Means food.